What was hospital gangrene in the Civil War? Have you ever wondered how injuries during the American Civil War could lead to infections that were often more deadly than the battles themselves? One of the most alarming conditions was hospital gangrene. This severe infection primarily affected wounded soldiers in military hospitals, where overcrowding and unsanitary conditions were rampant. Hospital gangrene was not just a battlefield injury. It was a consequence of the medical environment. This infection arose when tissue died due to infection and a lack of blood supply. As a result, the affected areas would decay rapidly, leading to a spreading infection that could be fatal. The term hospital gangrene specifically refers to cases contracted in hospital settings, distinguishing it from other types of gangrene that might occur elsewhere. Conditions in these military hospitals were dire. Soldiers sometimes had as little as 175 cubic feet of space each, which is far below the recommended 1,600 cubic feet per patient. This cramped environment, combined with poor hygiene practices, allowed infections to spread quickly among the wounded. Surgeons at the time lacked a complete understanding of germ theory, which meant their attempts to improve ventilation often made things worse by introducing more bacteria into the air. Many wounds that seemed minor at first could quickly escalate into severe infections. Treatment options were limited and often painful. Doctors used harsh substances like turpentine, nitric acid, and iodine tinctures in an effort to stop the infection. Unfortunately, these treatments often damaged healthy tissue and sometimes made the situation worse. When gangrene could not be controlled, amputation of the affected limb became the common practice. While this was a traumatic procedure, it was often the only chance for survival. Some surgeons, like Middleton Goldsmith, tried to document cases and experiment with treatments. They found that bromine-based therapies could reduce mortality rates in their wards. Despite these efforts, the overall mortality rate for hospital gangrene during the Civil War was around 45.6%. This high rate reflected both the deadly nature of the infection and the limitations of medical care at that time. The prevalence of hospital gangrene during the Civil War highlighted the urgent need for better sanitation and understanding of infection control. Although the war itself was a time of suffering, it also laid the groundwork for future advances in medical science, including the development of antiseptics and a better understanding of germs. Hospital gangrene was a tragic reminder of the challenges faced by medical professionals and the soldiers they treated during this tumultuous period in American history.